The two upper panels are human MAP. The bottom left panel is bovine MAP. And in all three, you see dose-dependent inhibition. It varies from strain to strain. There's no inhibition whatsoever with the control avium strain. The conclusions are, of the two components of thalidomide, furfuramide has no effect on MAP growth. Hydroxypiperidine is the active moiety. Inhibition by thalidomide isomers is strain-dependent, just as happens clinically. Thalidomide and its isomers and components affect only MAP and not avium. Our conclusions, therefore, are methotrexate, 6-MPN thalidomide in high doses are treating eukaryotic malignancies, and in low doses are probably treating prokaryotic infections. We then looked, I beg your pardon. We looked at some other immunosuppressants. We looked at tacrolimus and cyclosporin A. They are used clinically to prevent rejection of transplanted organs, and they are also used in so-called inflammatory diseases. And once again, you see, we've got the controls vertically and horizontally, and then you can see that cyclosporin A in the purple line is consistently the most effective of these agents. The conclusions are 5-ASA, methotrexate, 6-MP, thalidomide, cyclosporin A, rapamycin, and tacrolimus are in fact anti-paratuberculosis antibiotics, and therefore in anti-MAP antibiotic trials, the control or placebo groups all unknowingly received anti-MAP agents. As a consequence, if considered ethical, all studies evaluating MAP for zoonosis must be reinterpreted or redone. Is there any correlation to them? Is there any correlation clinically? And the answer is 6-MP and methotrexate eradicate MAP DNA from blood. Monensin used by the dairy industry as a ruminant growth enhancer, shown in red, with both human and bovine isolates, causes dose-dependent inhibition of MAP. And finally, tobacco use exacerbates Crohn's, so we tested the hypothesis that nicotine or its analogs might inhibit or enhance Crohn's. You see here the red is isoniazid, inhibits. Nicotinic acid for the first time in the lab enhanced. Both beta and alpha NAD enhance. This is the same study, but different values on the ordinate, and you can see that nicotinamide at a 10-fold dilution enhances. However, as shown on the right, these agents have no enhancement effect on a TB animal. Conclusions in the doses tested, nicotine has no effect, but nicotine structural analogs profoundly affect the growth kinetics of MAP, but do not enhance the growth of M. tuberculosis. And our final conclusion is the following. Multiple inflammatory and autoimmune diseases are treated empirically with previously unrecognized anti-MAP agents. We hypothesize that some of these diseases might be caused by Mycobacterium avium, subspecies paratuberculosis. Thank you.